spoonful of medicine, bringing you well-researched medical information. What are net carbs? Many times people might come across labels on food packaging that state the term net carbs. The term net carbs became a trend when low-carb dieting fads started. This increase in demand for foods to have low carbs prompted many companies to start marketing their food products in a way that showed it had low carbohydrate content. Net carbs are also called digestible or impact carbs, and can include both simple and complex carbohydrates. Simple carbs contain 1 or 2 sugar units that are linked together, and can be found in foods such as milk, sugar, vegetables, honey, or syrups. Complex carbs may have multiple sugar units linked together. Examples of such foods are rich starchy ones like potatoes. One can calculate the total carbohydrate count in grams with the following equation. Total carbohydrate count are equal to the food's total weight less the protein, fat, moisture, and ash. Ash refers to residue from proteins and carbohydrates. The amount that is left is the total carbohydrate count. For example, a medium-sized avocado is around 17.1 grams of total carbs. Of this, 13.5 grams is fiber. Using the equation, 17.1 grams of total carbs less 13.5 grams of fiber leads to 3.6 grams of net carbs. The U.S. Food and Drug Administration or FDA requires companies to include a full amount of grams from sugar, alcohols, and fibers. Sugar alcohols are sugars that have the toll at the end of their name. However, although present in a product, these sources do not have a lesser impact on blood glucose, since the body only partially converts these sources into glucose. The companies then started to use net carbs by subtracting the grams of sugar alcohols, fiber, and glycerin from the total grams of carbohydrate. In other words, net carbs is the total amount of fully digestible carbohydrates that are available in a particular food item or meal. The problem with this is that some of these sugar alcohols, fiber, and glycerin that was subtracted does in fact get absorbed, or metabolized to glucose. Another important point to note is that the term net carbs is not defined by the American Diabetes Association or the FDA. It is not agreed upon by any nutrition experts. How to read the nutrition label. The best way to approach this is to read the nutrition label. Some things you want to look out for are the product's sugar alcohol content. Subtract half of the grams of sugar alcohols from the total carbohydrate grams, and consider these are available carbohydrates that you must consider to adjust your insulin. The only exception is the sugar erythritol. If that is the only sugar alcohol mentioned in the ingredient list, you can subtract all of the grams of sugar alcohol. This is because sugar alcohols can affect the blood sugar and insulin levels differently. In other words, except for erythritol, all other blood alcohols can raise blood sugar and insulin to varying extent. Some of the different sugar alcohols and their glycemic and insulin index are shared here. The product's fiber content. The product's fiber content. Food products may have different kinds of natural and manufactured fibers in them. This affects their direction and how they may impart blood glucose. If the label says insoluble fiber, you can subtract all of it from the total carbohydrate grams. The result is the available carbohydrate grams for insulin adjustments. Another important thing to note is that if you live outside of the USA, your total carbohydrate line already has removed the fiber content and listed it separately. What does it mean for my diabetes? It means that while you may be able to calculate the total net carbs, it may not always be accurate. It may also make it difficult for people to manage their diabetes because of these variations. Because of this variation, patients may end up eating more sugar, just because they read on the label that it had lower net carbs, thus risking an increase in blood sugar and creating more problems for their diabetes management. For diabetes patients, it may be better to count all carbs so that they can manage their blood sugar better. Keep watching our videos to learn more about healthy living and nutrition. If you like our videos and want to learn more, please leave a comment below. Subscribe and share to help others.